Durian and heart disease, a dangerous combination you should know about. Durian, often referred to as the king of fruits, is beloved in many Southeast Asian countries for its unique flavor and creamy texture. Despite its popularity, durian is one of the most controversial fruits in the health world. While it contains several nutrients, including potassium, fiber, and vitamin C, durian can pose serious health risks, especially for people suffering from heart disease. For individuals with heart conditions, consuming durian may do more harm than good. This article explores how durian affects heart health and why patients with cardiovascular disease should think twice before indulging in this tropical delicacy. 1. High saturated fat content. Durian is relatively high in fat, with about 5 grams of fat per 100 grams of flesh. More concerning, however, is the fact that a significant portion of this fat is saturated fat. Saturated fats are known to increase levels of low-density lipoprotein, or bad cholesterol, which can clog arteries and elevate the risk of heart attack or stroke. For individuals with existing heart conditions, excess saturated fat can raise cholesterol levels even further, lead to plaque buildup in arteries, increase blood pressure, reduce blood flow to the heart. While healthy individuals might tolerate occasional durian consumption, people with coronary artery disease, high cholesterol, or heart failure should be especially cautious. 2. High caloric density. Durian is very calorie dense. A single durian fruit can contain up to 1,500 calories depending on its size. This is a significant amount, especially for people who need to manage their weight due to heart problems. Excess calorie consumption can lead to weight gain, which puts more strain on the heart. Obesity, a major risk factor for hypertension, stroke, and heart disease. Higher chances of developing metabolic syndrome. In short, durian's richness may be satisfying for the palate, but burdensome for the cardiovascular system. 3. Potential to raise blood pressure. Durian contains a notable amount of potassium, about 436 milligrams per 100 grams. While potassium is generally good for lowering blood pressure, consuming too much potassium at once, especially from a fruit so calorie-dense and metabolically active, can create imbalances in people who are on blood pressure medication, have kidney problems, which often accompany heart disease, are sensitive to large changes in mineral levels. Moreover, anecdotal reports suggest that some people feel heart palpitations or a rapid heartbeat after eating durian, possibly due to a combination of compounds such as ethanol, sulfur, and fatty acids affecting metabolism. 4. Negative interactions with medication. Durian may also interact negatively with certain heart medications. For example, people taking ACE inhibitors or potassium-sparing diuretics might be at risk of hyperkalemia, too much potassium in the blood, when consuming potassium-rich fruits like durian. Durian contains sulfur compounds that inhibit alcohol breakdown, which could potentially interact with certain heart medications or amplify side effects. Some people report feeling overheated or having a flushed face when combining durian with alcohol, which can stress the cardiovascular system. Although more clinical research is needed, these interactions should not be ignored by heart patients. 5. Misconceptions about durian being healthy. Durian is often marketed as a superfruit due to its nutrient profile, including fiber, antioxidants, and vitamins. However, healthy doesn't mean safe for everyone. For heart patients, it's not just about nutrients. It's about how those nutrients interact with their existing condition and medications. In fact, the sugar, fat, and calorie content in durian outweigh many of its benefits for people who already suffer from cardiovascular issues. 6. Overeating risk and addictive taste. Durian's sweet, creamy taste makes it easy to overeat. Unlike apples or oranges, which fill you up with fiber and water, durian is dense and rich, more like dessert than a typical fruit. Overeating durian can cause blood sugar spikes, especially dangerous for those with heart disease and diabetes, acute indigestion or bloating, which may cause discomfort in people with enlarged hearts or heart failure in some cases. Symptoms like dizziness, sweating, and a racing heartbeat have been reported. This risk is worsened when durian is consumed late at night or alongside alcohol or heavy meals. 7 practical tips for heart patients. Regarding fruit choices. If you or someone you love is living with heart disease, here are some practical dietary tips when it comes to fruit. Choose fruits low in sugar and calories, such as strawberries, blueberries, apples, kiwi, and grapefruit. These fruits offer antioxidants, fiber, and vitamins without overwhelming your cardiovascular system. Watch your portion sizes. Even healthy fruits can cause spikes in blood sugar or add to calorie overload if consumed excessively. Avoid fruits that are processed or preserved with sugar. Dried fruits, candied fruits, or fruits in syrup can significantly raise your daily sugar intake. Avoid high-fat tropical fruits, like durian or jackfruit, if you're on a restricted fat diet or suffer from high cholesterol. Monitor how your body reacts. If you feel flushed, dizzy, or fatigued after eating certain fruits, especially durian, take it seriously and consult your doctor. 8 cultural awareness versus medical reality. In many Asian cultures, durian is not just a fruit. It's a tradition, a treat, and a source of pride. However, cultural familiarity should not overshadow medical facts. Many people believe that natural means safe. But not all natural foods are beneficial for every health condition. Doctors across Asia have frequently issued public health warnings, especially during durian season, to raise awareness among the elderly and people with chronic diseases. The concern is not just the fruit itself, but how it is often consumed in large quantities with alcohol or late at night, increasing the risk of cardiovascular events. 9 final thoughts. Know your limits. The bottom line is this: durian is not inherently bad, but it is not suitable for everyone. For a healthy individual, enjoying durian in small portions once in a while may not be harmful. But for those living with heart disease, high blood pressure, or metabolic syndrome, durian can trigger serious complications. It is vital to understand that not all healthy foods are safe for heart patients, and dietary choices should be made based on individual health needs, not social trends or taste preferences alone. If you have heart disease, speak with a registered dietitian or cardiologist about your fruit consumption. Make sure you're not unintentionally putting your health at risk with choices like durian. When in doubt, opt for heart-smart fruits rich in antioxidants, fiber, and low in fat and sugar. Your heart deserves the best care, not just medication, but also informed eating. If you found this information helpful, don't forget to like the video to support our content. Share it with friends or family who need to protect their heart. Subscribe for more science-based health tips every week. Your support helps us spread awareness and save lives, one heart at a time.